Good evening, everyone. We apologize for being a little bit late. We were running into some technical issues, but we've gotten those resolved for the most part. And I want to welcome you to our virtual Facebook and YouTube pages for NBC6 Voices. I am your host, Jawan Strader. Well, we've seen a spike in COVID cases here in South Florida. You've heard about it. We've seen a spike here as well as across the state. And we're currently leading in the nation for the highest number of new COVID cases. And Miami-Dade County is the #1 county in Florida for new cases. Last week, the latest COVID-19 weekly situation report was published by the Florida Department of Health. There was a 15% rise in total cases from the week prior. And the Black population in Florida is the least vaccinated, with only 891,000 people vaccinated. Now, listen to this. That's in comparison to the white population, who has over 7 million people vaccinated. So about 12 million Floridians are vaccinated, and about 8 million others who are eligible to get vaccinated haven't done so yet. And that is where the problem is coming from. You've been hearing a lot about what's happening. So since the new Delta variant has been spreading, things have been getting worse. More rapidly, though, than its predecessor, this variant has been tough on people. So more people are taking an interest in getting vaccinated now because of it. So take a listen at what some locals had to say yesterday at a vaccine site in Miami. Listen.
Why did you wait until now to be vaccinated?
Because I am frightened enough now. I was waiting for it to go away, and it's not going anywhere. And I decided that, you know what, everybody else in my house is vaccinated, and I'm the hesitant one. I really didn't want to do it, and I was kind of waiting.
We're happy that she's finally getting vaccinated. We've been begging since January.
You're getting vaccinated now?
Yeah,
Why?
because I heard the news in the morning about 7,000 people with COVID today in Florida.
Why did you wait this long?
Dumb.
You should have done it sooner.
Exactly.
Well, I appreciate her honesty. So here with me to talk a little bit more about why they have not gotten vaccinated. And I appreciate him coming on the show. Please welcome TJ Legacy Cole. Now, TJ is a journalist. He hosts a podcast called The Soapbox. But like I said, he is also unvaccinated. TJ, welcome to the show.
Thank you, Duane. Thank you for having me.
Thank you for your bravery by coming on my show and taking these tough questions from me. But this is
if I can give them, I can take them.
Okay, you got it, my brother. Well, TJ, let's talk now. Why?
Mm-hmm.
Why is it that, first of all, you didn't get vaccinated with the first wave of vaccines when it came out? Why?
Well, I believe that, and I just want to start off by saying I commend anyone who has been vaccinated. I don't classify myself as an anti-vaxxer at all. I believe that if you want to be vaccinated, I believe it's a personal decision. And if you do so, you're making the right decision for you, your body, and your family. However, for me, I wanted to wait because as we've seen studies with Dr. Casper in the University of Illinois, he said that this pandemic, the virus actually can mutate. And so it's forever changing. And so I decided, you know what, I'm not going to say I'm never going to get vaccinated. However, I'm going to wait until I see the side effects, not just in family or friends, but see how the trends, how they are projected moving forward.
And so you decided to wait and see on those trends, but were you at all just fearful or worried or concerned about your health?
No, well, of course, you're always concerned about your health, and I think health and wellness should be everyone's top priority. For me, I've actually consulted with my primary care physician. I've actually reversed my diabetes within the year of the pandemic. So I've been the healthiest I've been in years. I've actually taken the preemptive measures by testing for whether or not I have COVID, which I do not. I'm fortunate enough to be remote, so I'm quarantined regularly, and I've always sanitized and continued to mask in large crowds, or whether I'm in resident or a business areas. So I've followed those guidelines, the initial guidelines of the CDC and those experts that we're talking about the virus. But as far as the vaccine, it was something that I was hesitant to do for a multitude of reasons.
And you said hesitant, so that's what I want to get to, because a lot of people have been hesitant, and that's why a lot of people haven't gotten vaccinated. I do know people who have decided not to get vaccinated. A lot of people go to the Tuskegee experiment, and they go to the history, especially involving Black folks. Tell me about what you were hesitant about, some of the things that kind of made you think, well, I think I'm gonna hold off.
Well, initially they said the report was from the CDC is that if you get vaccinated, you're not going to have to wear a mask. Well, we see as of today, that's not true. They're now creating a new mandate saying that, hey, we recommend that even if you are vaccinated, that you still need to wear a mask in public like the people who are unvaccinated. So you have a lot of people, and I believe a lot of the inconsistencies in the report from not only from our government, but our government agencies, but also within our local media. And besides, I really feel like the rollout wasn't the best when it comes to the education component of the vaccine. We politicize the vaccine, whether it's a red or blue type of issue, rather than talking about healthcare. Now, the same government that has been back and forth this whole time in Congress trying to prevent universal health care is now trying to universally distribute a vaccine. So those inconsistencies to the general public give people enough pause for cause. And then we also have from the CDC website that the vaccine gives you tiredness, headaches, chills, pains, nausea. You can develop a lump from the area or a bruise from the area of the vaccine. These are from the CDC websites. And then we talk about the dynamic of African Americans and our trust in the government. And when it comes to vaccines, you mentioned the Tuskegee experiment. We still are dealing with the effects of Black women and their mortality rate when it comes to giving birth, their birth rates, delivering birth, how they're 3 times more likely to die, whether or not, as opposed to their white counterparts. And so when we're seeing the mistrust in government, and we're seeing, it's a multitude of things that have come into it. So for me, it's not that I'm not going to be vaccinated. It's I'm going to allow people who want to be vaccinated. You can go first, and I'm perfectly fine with doing my preemptive measures and living with those consequences and quarantining until we understand in a totality and everybody can get on the same page. That means government, media, everybody can be on the same page as to what is where we're going with this vaccine.
And TJ, do you have any personal stories? You know of anyone that passed away? It's like most of us know at least of someone, if not a family member, that has passed away because of COVID. Did that at all have any impact on your decision?
Oh, absolutely. I'm a community organizer and a political activist at heart. And so there's plenty of people that I've known that or either have family members that have passed away due to COVID-19, or people who have contracted COVID but then have had to recover it. But this goes back to it being a personal decision. It's a personal decision. I don't believe that any government agency should have autonomy over any one person's body. Now, for instance, if I was a woman and I became pregnant, and there may be people out there that says, hey, I think that we're overpopulated as in a world or this country, and so you shouldn't have an abortion. I don't think anybody should be forced to by any government agency to do something to their body. Now, they have a right to make sure that they are, and a moral obligation to make sure that they are protected in the best way they see fit. So that means wearing a mask, sanitizing your hands, doing those things. But as far as putting a vaccine that you don't know whether or not it's actually going to be effective across the board, I think it's enough pause for cause for people to say, you know what, I want to wait and see what happens. I think it's actually responsible to do that. And then when we talk about, you mentioned African Americans, me being an organizer, we're dealing with the pandemic or the epidemic of social justice. And I think a lot of the pushback from African Americans with the vaccine has to do with that. Where we protest all summer about, us dying in the street disproportionately by the hands of law enforcement, and what we want our government officials to do and create legislations to protect us. Yet they're hesitant on that. And so the same people that are telling us they can't do anything as far as legislation is now turning around and telling our same community that are disproportionately affected by that to say, hey, we can't do anything about the disproportionate killing of people in your communities, but here we have this vaccine for you. This is going to save your life. Well, it's like, well, which one is it? Well, you should, if this is important as well, and I believe it is, then also you should pass legislation in order to protect us as our in our communities as well.
So fast forward now, because now we're into the Delta variant. We've had a few different variants. We had the Alpha, the Beta, as we know. We've gone to a Greek system when it goes to the different variants that are out there. So your thoughts now, will TJ Legacy, will he be getting a vaccine?
As of right now, it's still a no for me as of right now. However, I do believe that we stopped quarantining too early. I think that if there's a Delta variant going on, we should revisit quarantining again. I think a lot of this has to do with corporate America and wanting to push, especially in the state of Florida with Governor Ron DeSantis, and wanting to push people too soon out there to the workforce. And not allow people the opportunity to quarantine or work from home and allow them to see what's going on with these medical experts. Like I said, the virus can mutate. It's forever changing. We're still getting new information. And you're asking people who are lay people. I'm not a medical expert. You're asking lay people to say, okay, definitively, I'm going to do this, when you have other medical experts that are still debating the effectiveness of the vaccine to this day. So I think it's like I said, if anybody has been vaccinated and it's working well for you, that's fine. But there are also others, and that's not being widespread reported, that have had side effects due to this vaccine. And I think people are rightfully so should have the opportunity to do what's best for them and their bodies and their families.
Okay, well, TJ, I don't want you to go anywhere. I want you to stay on
Absolutely
with us as we continue this conversation. And we have others that's going to basically educate folks out there on the vaccines, because you brought that up, and why the cases are rising here in South Florida. So I believe we have a signal working right now as Dr. Inaki Bent. Dr. Inaki Bent, are you there? Okay, you're muted right now. So let's see if we can get that unmuted.
Can you hear me now, Juwan?
I can hear you now, brother. It's great to have you, as always.
Great seeing you. Thanks for having me back.
You got it. You got it.
Good evening, TJ. Nice to meet you.
Good evening, good doctor.
Now, along with Dr. Inaki Bent, who happens to be an internal medicine doctor with Jackson Memorial Hospital Health Systems, I want to have Linda Joseph join the conversation as well. Linda has been fighting for South Floridians to be vaccinated since the vaccine became available. And I want to welcome to both of you to the show, because I want to have this conversation with all of you. I don't want to take one out the conversation. But Linda, first of all, I want to hear your side. You heard TJ. So you heard some of the things he was saying. Very intelligent, very, very smart. I see him taking his time, measuring different things. But I want to know your thoughts on some of the things that he said in regards to why he's decided not to get vaccinated as of right now.
Yeah, absolutely. Listen, I thought his answer was thoughtful. And the thing about it is that me and TJ do the exact same work. I'm an activist. I am also a community organizer, the same job Jesus Christ did. So, Bill, that's saying that also, it's my job also to get the data, get the information that is not relatively available to people, to marginalized community and underserved community. So I had the great opportunity to work with a federal site, one of the most successful vaccination sites at my brigade. We vaccinated almost close to almost 10,000 a day. And I think this is the one thing the DOD said to me about, I was concerned. All my family and everybody I know is vaccinated. I was concerned about my daughter, who was born with a heart condition, they were saying that the vaccination had something with the heart. And what he said to me was so profound. He said, I am more concerned about what the virus can do than the vaccination. After he said that, that was a done deal for me. I knew that we need to get vaccinated. Listen, we've been vaccinated all our lives. I remember taking my tiny little baby at 4 months old to get 4 or 5 vaccinations. she is now here. She is thriving. She's just thriving like she should. I am excited about this vaccination. This is what we've been praying for. I watch people die in my community because this vaccination was not available yet. So I am excited. I'm ecstatic. I will encourage anyone who would give me a moment and tell them why I think they should be vaccinated and why this is such a great opportunity so we can start getting out of this pandemic. It's my thoughts.
Amen, Linda. Well, hold those thoughts because, and just like you said, we have been vaccinated most of our lives because they used to have to hold me down, two nurses, in order to get me to get that shot when I was about 5, 6 years old. So I remember getting those shots when I was younger. So I totally agree with you there. I want to bring Dr. Inaki Bent back into the conversation, though. Dr. Bent, I want to know basically why is it that we're leading the nation in COVID cases? Can you explain why so many people in South Florida may be hesitant to get vaccinated? You heard from TJ.
Yes, and I appreciate all his sentiments. Thank you, Linda, for that passionate expression. It has been about 6 months since I was last on your show, Jawan, and the dynamic has completely shifted. We finally have a tool in our arsenal to stave off this pandemic. I think the reason that folks are becoming more and more hesitant is the fact that, like Brother TJ mentioned, they're citing the Tuskegee study, and there's a lot of distrust within the community. However, I asked TJ, how long are we going to allow the experimenters of the Tuskegee experiment to victimize us? They victimized the participants of the study, but here we are, nearly half a century from the close of the study, and we're still talking about Tuskegee. We have clear-cut evidence that this vaccine is saving lives, specifically within our communities. Here at Jackson Health System, from 2 weeks ago, we went from 66 inpatients to a whopping 205 inpatients. That is more than 150% increase in hospitalization. And what we're seeing are people are sicker. They are, the incubation period is a lot shorter. So when you saw an incubation period of 10 to 14 days, now we're seeing that people get the virus on Friday, and on Monday or Tuesday, they're showing symptoms and they're showing up to the emergency room gravely ill. And this has become a pandemic of the unvaccinated, unfortunately.
So, Dr. Inaki Bent, okay, so I'm going to shoot out some questions for you, okay? And then TJ, I want you to respond to. But Dr. Inaki Bent, okay, let's go for it. All right. So I got vaccinated. If I got vaccinated, can I still get the virus?
The answer to that, Jawan, is yes. What the vaccine does is prime your immune system in preparation for a potential infection. If you look at the number of patients that are hospitalized, more than nearly 95% of the admitted are unvaccinated patients. Those who have been vaccinated that become ill, they have mild symptoms. So the vaccine is doing its job. Whether you test positive or not, your immune system has built up certain defenses to keep you from being gravely ill, hospitalized, intubated, and we aren't seeing any patients who are vaccinated who have died in the hospital yet.
Okay, Dr. Inaki Bent, next question. So why not just go ahead and wait and see how this thing plays out? Why not wait and see how these variants play out and see how the vaccine works? Why should I get vaccinated right now?
The reason you should be vaccinated now is because we are dying right now. Time is of the essence. We aren't at the levels where we were last July. However, I am terrified at the numbers at the rate that they're climbing. And the difference between now and last July is that we have a vaccine that has proven to decrease the numbers. The reason that we're able to open up, the reason that kids are going back to school, the reason why the economy has opened up is due in part to the vaccine. And what the community needs to know is that this Delta variant is more virulent, it's more contagious, and is deadlier than the Alpha strain, the original strain. And even though you may not get sick with the actual virus, you can still transmit. You are shedding thousands of times more viruses than the original coronavirus. So you are helping your community, you're helping your family members, your all your loved ones, your community as a whole. It's the patriotic thing to do.
But Dr. Inaki Ben, I don't want to get the vaccine. I don't want to get the vaccine because if I get the vaccine, it may kill me. I don't know how my body's going to react to the vaccine. There could be people that could be dying from the vaccine. How do you explain that?
The research shows that a very small percentage of patients have passed away or have gotten severe complications from the vaccine. To that patient, to that person who's contemplating whether or not they should take the vaccine, I encourage research. Speak to those who have the knowledge and the experience. Speak to your primary care provider. Speak to others who in the community who have taken the vaccine, and the overwhelming evidence shows that it is doing what it is meant to do.
Okay, TJ, I know you want to go ahead and chime in on this. You're on mute right now, so come off of mute. I want you to chime in now. Hearing Dr. Inaki Ben speak on some of the questions, some of the things I just posed to him. What do you think about some of these answers? And then I want to go back to Linda.
Well, I thank you for your response. I do want to touch on, initially you said the how long are we going to allow the Tuskegee experiment to dictate how we are today? And I will just say that specifically African Americans and our ability to have atonement over our own bodies, that has gone on before the Tuskegee experiment, where and these are things that have happened since the foundation of this country, as I'm sure you know. So it is ingrained in us to be hesitant or to have pause for cause when it comes to anybody doing anything with our bodies, especially since in the medical profession, as you are aware of, how we are disproportionately affected across the board when it comes to different diseases, or as I talked about, birth rates within African American women. So these are, when it comes to the medical profession and how African Americans feel, these are one of the pillars of a system of white supremacy that allows the distrust within the community. On top of that, the rollout of the vaccine education was something that was a bit disrespectful to our community. Whenever we want to educate African Americans on an issue, they never treat us as adults. The problem is that we have celebrities, rappers, and everybody and athletes telling us, oh, well, you should just go ahead and just get the vaccine, as if we're one monolith. And just because a successful actor or athlete says to do something, we're all supposed to just go to the beat of the drum. And I think you're seeing a lot of pushback as more African Americans are becoming more socially aware and conscious because of what are going on in the grassroots. There's more pushback to say, wait a minute, why do you keep, anytime you want to roll something out to us, we're always seeing all of these rappers and all of these people who don't really represent our actual community come out and tell us this information. The second thing I wanted to address is, you also mentioned that you said that there is a chance that somebody could pass away even if they do have the vaccine. Well, I would then say, I would raise you this, that if I had 10 of my family members, and you're saying that if I don't get vaccinated, let's say 40 or 50% of them are pass away, right? Because they're not vaccinated. But then if we're all vaccinated, and then we still have a chance where, even if it's a small chance, 20% or even 10% or one family member can still pass away with getting the vaccine, that's enough. I don't think I value life. And so if you're telling me that whether or not you get a vaccine, there's still an opportunity or a chance for somebody to pass away, that's not enough. And I don't think people are willing to risk that to just say, well, you know what, I'm going to go ahead and get a vaccine, but I can risk, if I get the vaccine, I still have a risk of having an effect that can cost me my life. It's one thing to contract something, but it's another different mindset to willingly go and take a vaccine that could be still a cause of your own death by your own summarization. So I think that in itself is cause for a lot of people within predominantly African American communities and across the board when it comes to whether or not they're going to receive the vaccine.
Well, let's let Dr. Inaki respond to that.
Thank you for that response, TJ. And I understand your sentiment. I appreciate your sentiment. But the numbers that we are talking about pale in comparison with the number of people who have actually died from the actual coronavirus. When you look at the numbers, it's a small fraction of the number of deaths that we've seen from coronavirus. Personally, I'd be more fearful. I'd be more devastated if I contracted COVID and let's say I didn't pass away, but I was left with long COVID symptoms and I'm a 40-year-old and I'm relegated to carrying around an oxygen canister for the unforeseeable future. That would be devastating to me versus compared to a potential side effect that may come from a vaccine. I just think it's just misplaced. We trust the science, and thus far, we've seen the evidence that it has dramatically decreased the death rate in our communities. Last fall, I spoke at a memorial recognizing the victims in the inner cities of Miami, and the numbers at that time were staggering. They were devastating. But I'm happy to say that the numbers have drastically declined, and we now have a fighting chance against this virus. And I think that's due in part to this vaccine.
Okay, well, I want to hear from Linda, because Linda, you heard from TJ as well. You heard his concerns, very eloquently put, by the way, but who's given it thought. So your thoughts on what he said there and his concerns over taking the vaccine?
I heard his concern. And one of the things I want to say, TJ, and it's not that I'm praising this administration. One of the things they did do, and they did it very collectively, is that they went to the grassroots. I am grassroots. I am an activist, and I went to the community and we knocked on doors. I think it's undeniable. Data is data. Everything else lie, everything fudge, but numbers do not lie. It is shown that the data, you have a better chance of surviving this with the vaccination. It's just clear as day. And another thing you said also, the doctor said is that how long do we allow what happened to our victim in Tuskegee? How do we let them victimize us? Yes, it was traumatic, and I understand it. But if we have a vaccination now that could, potentially save our lives, we need to take advantage of it. And I'm saying, I've seen us on the ground. They went to we had this organization of Black women taking care of the families, and we knocked on doors every evening, giving the vital information about the vaccination and what it is to do. I've watched people die. I know for certain over 600,000 people have died without the vaccination. I don't know how many people have died with the vaccination. But I know for certain in our country, we have 600, and a lot of them with minorities. And that's one of the things that we really need to put out. The data is clear. The numbers are clear. Our people would die in most proportionate than anyone. So we more so need to get the information out to them more than anyone.
And with that said, Linda and TJ, you said something that I thought was interesting, because it's so true. The Black community has been disproportionately impacted in the healthcare field and in healthcare in general. When it comes to birth rates, we could go on and on. We could talk about high blood pressure. We could talk about heart disease. We could talk about all those things. When you see the numbers, you heard from Linda. You heard me talk about those numbers of Blacks that have gotten the vaccine. And then you heard from Linda talk about people of color who have passed away from COVID being disproportionately affected.
Yeah.
What you just talked about. Why? Because of education or lack thereof.
Yeah.
So
Well,
I want to know. So with that said, you said something that stood out to me because I'm like, hold up, your own argument. You had your argument there, but sure enough, you answered your own argument before you went in and you started talking to the doctor. So I'm curious as to your thoughts on that because the numbers don't lie.
They don't lie. They don't lie.
Well, and this is why I stated and I prefaced my comments by saying that this is an individual decision, right? So there are some that will look at this and say, well, you know what? I listened to Linda, I listened to the good Miss Linda and the good doctor, and that's enough for me. As you stated before, I've done my research that's for me in my edification. So it's like I said, it's an individual decision. Myself,
Absolutely.
I've been tested for COVID-19. I've never contracted it. I've been one of the lucky ones. I've taken preemptive measures to not contract the virus. I've quarantined regularly, and I wear my mask regularly. And I've also had my lungs scanned. So at this point, in this juncture, as I'm watching the Delta variant, as I'm watching the first wave of vaccines, as I'm seeing the side effects, and I'm also seeing the successes of the vaccine for individuals, it's my responsibility to the community as a political organizer and an activist to not dictate to people and tell them what to do, but to give them the information for them to empower them to make their own decisions. Similar to when I talk to them about whether it's voting or whether it's social justice issues. It's not me preaching and dictating to them what they should do and pointing my finger at them or shaming individuals. And I think a lot of that is going on within culture, is that if you're not vaccinated, you're now starting to be shame, just like people so if you're someone who's an anti-masker and you're also someone who is vaccinated and you're shaming other people for not being vaccinated, you're both a part of the problem because you're not helping the educational component. And that's where I stand as a journalist. That's where I stand as an activist, to say, this is what I've done, the research I've done for me and my body and my medical history. You too need to empower yourself and do your research and make those decisions based upon the data and based upon what's going on in your community to make the best decision for you and have autonomy over your body.
And I believe, you know what, I totally agree with a lot that you said, because I don't believe that we should preach, but I do believe in education. And
Correct.
I believe that we should educate at the same time. But most importantly, it's about empowering our communities, right? So, and you said that it's important that we empower our communities, but we empower them with knowledge. And if we are able to listen, and that's why we're having this conversation here tonight. And with that said, Linda, and then Dr. Bent, I'm going to come with you basically for last words. But so Linda, how do we educate those who are not vaccinated to maybe think about getting vaccinated in order to save lives?
The truth is, on the trail, when I'm knocking on doors, they want the information. They want to know more, and they want to come. And sometimes, and I heard TJ say that they're shaming them about not being vaccinated, and I find the complete opposite. I find family members who telling the vulnerable not to get vaccinated. When I was at the vaccination site, people would come incognito, so people won't see them from their church or see them from their organization that they were getting vaccinated. I think there would always be a segment of our community that rely on us to give them the information, just the raw truth, just the raw numbers, not anything emotional, just numbers and data, and show them the science. I think we owe that to our community. And if we can show them the success, or we can show them what's been proven to be effective, I think that is what we mean by empowering our community and teaching them. Because I'm telling you, knocking on these doors and talking to people, they're like, I want to know more. Is there more? Where do I go? Does it cost money? So the information in the grassroots still need to be done. I'm out here, and a lot of us are still out here. It's still needed, and we still need to have it done. And I think the best way we arm our community is with raw data and the numbers and really educating them about what happens if you do not get vaccinated, what the possibility that can happen, and what has already happened. It's just, like I said, I am really excited when the vaccination come out because we could come back to normalcy. I was petrified when we had no vaccination, we had no outs. It was just a tunnel. This vaccine gave us a hope. It gave us, like, next year, my daughter's going back to school. I was petrified. The fact that she is fully vaccinated, my son is fully vaccinated, that gives me a level of comfort as a mother. It doesn't erase everything, but at least I gave them something that to defend if they get the COVID.
Amen. Well, thank you for your thoughts, Linda. And Dr. Naki Ben, I'm going to leave you with the final word here. You've heard from Linda. You heard from TJ Legacy. Your final thoughts on why folks should think about getting the vaccine if they haven't done so already.
Sure. Thanks again. And I'd just like to share a couple personal stories. In addition to my clinical work at Jackson, I've been, because of my standing in the community, friends, family, and friends, they all reach out to me to consult on family members or other relatives that have contracted COVID. A very close friend of mine got her entire family vaccinated, and she had one sister who refused to get vaccinated, and unfortunately she contracted COVID-19. Fortunately, she did not pass away, but she spent several days in the ICU, and the unintended consequences and all the stresses that the family goes through because of that decision, when she looks back at it, she is regretful. Just simply taking the vaccine could have helped alleviate many of those issues. And secondly, I had another close personal friend, and this is particularly for TJ. The reason that we get vaccinated is two parts. It's for us individually, but also to help protect the community. His father, who is 78 years old, went and got vaccinated. He did everything that needed to be done, but unfortunately, with the Delta variant circulating, he contracted COVID despite being vaccinated. And this is a gentleman with multiple comorbidities, and he spent several days in the ICU. So TJ, if you would think about this gentleman here when considering whether or not you're going to get vaccinated or not, I truly appreciate it, and I think his family would also appreciate it.
Okay. Dr. Naki Ben, thank you so much. TJ, I know you wanted to say some more, but I appreciate you, man. We're just running out of time. Linda, as always, thank you. I really appreciate you. And I just really appreciate the diverse thoughts. And this was a conversation. This was not anywhere near shaming or anything else. And I think it's important to understand where both sides pretty much lie on the issue. So I appreciate you so much. And I want to thank everyone out there. I want to thank you for watching, for listening to this. This is a hot button topic that a lot of people have been talking about, and I just want to encourage you to make your own decision. You heard from TJ, but also, most importantly, do your research. The numbers don't lie. So you can watch this program each and every Saturday morning. We are taking a break because of the Olympics. And so we will be back very soon on Saturday mornings at 9:30 a.m. We haven't gone anywhere. That's why you can check us out virtually. Be sure to follow us on Instagram and Twitter at JawanNBC6. Also, as well as Facebook. Let me know what you thought about the show, about our conversation. Let me know. And before we go, remember, education is the key to success. If you believe, you will succeed. We'll see you next time. Have a great week.
That was great.